Hello, good afternoon. Thank you for joining the Ventura County COVID-19 update. My name is Kelly Long. I'm your Ventura County Supervisor Board Chair. And on behalf of the Board of Supervisors here in Ventura County, we want to say thank you to all of you who are following the Stay Well at Home orders and the state guidelines for making sure that we're socially distancing, washing our hands, wearing masks when going into businesses, and really just doing everything you can to stop the spread of COVID-19. Along with that, as we are in fire season, I just want to wish our firefighters that are helping with the fires up north, I hope them to return safely and that their families are doing well. I also would like to remind people that we have our 2020 census still going on. If you could please make sure you have registered on 2020census.gov to make sure your family in your household is registered. Those funds, $2,000 per person, can add up to an amount that is much greater in which the Ventura County uses for the umbrella services that we provide our community. So to go online at 2020census.gov, I think this week is the end, so please do it. Also, seasonal allergies and flu is coming up, along with our COVID-19. Please make sure you're following the procedures you need to keep yourself healthy and just healthy, please. Yesterday we had our Ventura County Board Supervisor. You can go to ventura.org/BOS. We had a 2-hour update on COVID-19, and in that meeting we really stressed how our county is working with the governor to make sure that we can open as quickly as possible. We have quite a few measures that you'll hear from Rigo Vargas, our health officer, that are way beyond the red in which we want to get to. We are close, but we're still at the purple tier. And that's unfortunate for us because we do want our restaurants to start serving indoors. We want schools to open up. We want more businesses to open up. But to do that, we have to have our rates in the red tier, and Rigo Vargas will explain more on that. We also have some new guidelines from the state, which is makes people happy. We have nail salons can now do it indoors, and if you're a senior, many times they go to a nail salon instead of a podiatrist when they need help. And also it's a good mental health as well. So there's many ways our nail salons are helping our community, and so I hope that you're supporting our small businesses like them as they start to open up a little bit more. We also have restaurants that are opening till now 11 p.m., which is good, and then also the ombudsman for our senior centers. There'll be some more information on that. Today we will also hear from Dr. Thomas Duncan, our Trauma Medical Director of Ventura County Medical Center. He will talk about our fall prevention for our elders. And Stan Mantooth, our Superintendent for Ventura County Office of Education, will speak in regards to the status of our schools. And like all those parents out there, I can empathize. I have 2 in high school, and it is extremely hard to ensure their education and working and everything else. My heart goes out to all those that have the younger kids that can't sit at Zoom and can't do things, and also the teachers that care and want to make sure they're educating, and it's very hard to be Zooming and getting everybody engaged. So more for that, like we said, we're really pushing to get to red and to work with our Office of Education to ensure the education for all in our community. We'll have Paul Stamper, our Deputy Executive Officer for our CEO's office. He'll be answering some other frequently asked questions with our guidelines, industry guidelines for businesses. And then we'll have Ron Ventura, our Supervisor for Environmental Health. With all the other seasonal allergies and flu and COVID, now we have another invasive mosquito that's coming out. The 2020 seems to be an amazing year. And then we also will have Mike Powers, our CEO, talking and just give an overview of any other items that we haven't discussed. So thank you so much for tuning in every Wednesday. And with that, I will have Rigo Vargas, our Public Health Director, come up. Please stay safe and healthy.
Thank you, Supervisor Long, and good Wednesday afternoon, Ventura County. Rigo Vargas, your Ventura County Public Health Director. Today I'll have the usual update on today's numbers. I'll follow with some reminders on some new developments, some new sectors that are reopening, and touch on testing. Then I'll conclude with some slides that give us an update on our metrics, as well as a few other information that we have on the slides. So first, with today's numbers, we're reporting 110 new cases. That brings our total to 12,285 Ventura County residents that have confirmatory tests for COVID. Not the illness, but the virus that can cause COVID, the illness. We're also reporting that no additional deaths, so good news there. We've had some stability there and not reporting additional deaths. In terms of our hospital numbers, we're reporting that our area hospitals, all 8 of them, that provide excellent quality care for COVID individuals that are in the hospital. Today they report a total of 47 Ventura County residents that are in our hospitals, again, getting excellent quality care. And 12 of those are in the ICU. Those are particularly not doing well, but we hope for a swift recovery, and that those individuals will be back home soon. So 12 in the ICU, 47 in the hospital. Though that 47 is a little bit on the higher side of the last 2 days. We reported really lower numbers. We were as low as 39 the other day. We hope to have a continued downward trend, but 47 has been around the average in the last few days, and overall we're showing a decrease in our hospitalization numbers. Finally, in terms of numbers, we're also reporting 1,104 additionally tested Ventura County residents. That brings our total to 178,837, so almost approaching 180,000 Ventura County residents that have gone and gotten tested at many of our sites. We continue to have 13 sites in Ventura County that we are operating in partnership with the state, and so please visit our website, VC Recovers, and you'll see the updated flyer there confirming 13 sites where you can get this test for free. And I want to clarify things. There's a few operators, private operators, that are doing testing for a fee. Please be careful and know which test you're getting. And if you're needing and wanting a confirmatory gold standard, what we call PCR test, for the detection of the virus that causes COVID, please make sure that it is free. At least on our sites, they are free. And we continue to have excellent testing capacity where the turnaround time for your test results are between 24 hours and 36 hours. So 1 to 2 days is our turnaround average. Please utilize those sites throughout Ventura County. Many of them, you don't need an appointment. You definitely don't and will not be asked to pay. And so you can either drive up or walk through and get your test at several of these sites. As Supervisor Long mentioned, there are some new developments, in terms of we're in full alignment with the state in terms of sectors that are allowed to open in tiers, in a tiered approach that the state has issued. We continue to be in the more restrictive tier 1, purple, but the state did come up with an exemption or an allowance, I should say, that nail salons can now operate even in counties like ours that are in the purple tier. Effective immediately, nail salon operators can resume indoor services. But, just as a reminder, there's nothing yet normal about, operations, meaning that these nail salon operators need to abide by the state's guidance on safe opening of indoor operations. And so we urge all nail salon operators to visit the state's website and familiarize themselves, if they're not, with the current guidelines for safe operations of nail salons indoors again. So if I can have the slide up, if it isn't already, want to now turn to a couple of slides. You're all familiar with our dashboard slide. This one is slightly updated from the one we presented at the Board of Supervisors yesterday. The first two numbers are the same because those numbers are as reported by the state on a weekly basis on Tuesdays. So I had mentioned a week ago that I was feeling optimistic that we would potentially be on a path towards the next tier, red tier, because our numbers were indicating that we might come in right under 7 or under that we need in terms of the average case rate per 100,000 resident. And as you can see, we're at 7.4. In fact, that number we know is actually 7.2. The state, again, does a one-time update, and they are reporting 7.4, but really we're even a little bit lower than that. Nevertheless, we did not meet the 7 or lower mark. Ventura County, please continue to do all that you have been doing because it is making a difference. That is a drop from 8.4 that was the previous week. That was our true 7-day average last week. It was adjusted a little bit lower based on a high test volume, but comparing the overall case rate last week at 8.4 to 7.4 is great progress, and so we will be at meeting that mark of 7 very soon. And so please continue to do all that that is needed to control and mitigate coronavirus, which is practice your social distancing, 6 feet apart, face coverings, hand hygiene, and avoiding large gatherings outside of your household, especially. So that's the case rate. In terms of the 7-day testing positivity rate, I can't be more proud of Ventura County residents than this number. This number, as we've said before, if the state was using this number to allow counties to move tiers, we would be in the 3rd tier. This number is so well. This is the testing positivity rate, meaning of the folks that are getting tested, which we want to continue to encourage everyone to get tested. If you feel you've been exposed, if you're just wanting to make sure, get tested. And this number dropped from last week, and 3.8 is an excellent positivity rate. And so that is really good news, Ventura County. Thank you for your work to abide by all the health officer orders, both state and local. The other green areas there is just those numbers are updated since yesterday. They're current. Our average daily test rate is 270. You can see the state expects counties to have 150 average daily tests per 100,000 resident. We're at 270. This number clearly fluctuates every day, but that's 270 that we're currently at is an excellent number. So continue to get tested. The others on the bottom there, you see that the state actually allows counties to move, have an increase of up to 10% in terms of the 3-day average of hospitalization. We're on a downward trend. In fact, we're minus 11. That means we have a sustained decrease in hospitalization numbers. Our hospitals continue to just be excellent partners. Look at our percent of ICU beds currently available at 44%, clearly meeting that initial goal that the state had set out for counties. And then also look at the 90% capacity that we have for ventilators in our county hospitals. The expectation was, the goal was at 25, and we have 90%. So again, please continue the good work, Ventura County. Your numbers, your efforts are resulting in better numbers for our county. If I can get the next slide. Okay, thank you. This is a new slide. It's a little bit busy. We'll see about putting it on our website today. This is a comparison of Ventura County with other Southern California and nearby counties. It's listed by testing rate, and you see that just below LA, Ventura County is doing outstanding with regard to our testing rate. At 221, LA is at 270, and then after that, all other counties have lower testing volume. And it's important for two reasons. One, getting tested is very important, not only so that you know if you're positive, so that we can work with you to have you isolate and have your close contacts be in quarantine and further control community spread, but also getting having this kind of high testing volume helps with an adjustment factor that the state has allowed for, and several counties are getting a significant adjustment factor for their case rate based on testing volume. And so we want to do it for both reasons. We have excellent testing capacity, so get tested, and in fact also it would help with our contact tracing and possibly to get an adjustment on our case rate. The other columns there have other comparisons. Case rate, again, we are a little bit over the goal, and you see that several other counties around us are under 7. And so congratulations to them, and us in Ventura County soon, I am very confident we will be there as well at 7 or below. Testing positivity, already explained that Ventura County is doing excellent. You'll see there that our 3.8 is among the best of the positivity rate compared to these other counties on this list. Finally, the last column has case fatality rate. And you see that Ventura County is among the lowest and the best when it comes to case fatality rate. At 1.2% is our case fatality. And you see that only Santa Barbara and Kern County have a similar low case fatality rate. And so that is a testament to early detection and treatment of those that become ill with COVID, and that survive and do not die even though they're infected. So overall, again, while we're short on that important metric of case rate, overall numbers are very good compared still with other counties, and more importantly, overall we have a downward trend. Next one. This is even a busier slide, so we will make it available to you. This one was also shared at yesterday's board meeting. Basically, we are showing the differences in case rates by zip code and taking 2 weeks point in time among 2 weeks, the week ending July 11th, which was a week after the last holiday, and then the week of September 12th, which is the week that right now the state has metrics on their website for all counties. And you can see that we have a sustained decrease in case rate among all communities, all zip codes. Some have a very sustained, dramatic decrease. Even those high communities with high case rates, they've also had significant drops when you compare these 2 weeks. So moving forward, we will have an updated, probably on a weekly basis, table here to show the continued progress in all communities with regard to case rates. Finally, we've attempted to have this table updated on a regular basis. We'll try to be more consistent on this. This table is a display of number of cases, of all our cases of Ventura County to date. How do they spread among vulnerable and essential workers, vulnerable populations and essential workers. You see there that the majority of our cases involve those with underlying health conditions. At 18% of all of our cases are among those that have underlying health conditions. It also, next is our elderly, 65-year and older persons. 8% of them make up our cases. Long-term care facilities and healthcare workers similarly each make up around 5.5% of all our cases are among those in long-term care facilities and our healthcare workers. Our brave first responders, they make up about 6%, 0.6% of all our cases. Inmates, we've been reporting a jail outbreak that is, while under control, it did increase our number of inmate counts. And so the percent, though, it's still under 1% of all our cases, which is a little bit over 12,000, 0.8 of those cases are among inmates. Homeless, 0.1, just outstanding collective work, city, county, family, working together, many staff, individuals, many resources to keep another vulnerable population protected as best possible, and it reflects that in our homeless, only 0.1% of all of our cases is among the homeless, 0.1%. Another essential population that we reported in the past is farm workers. And so, yes, previously we reported a couple of large outbreaks, especially at the housing site of a couple of months ago. At that point, our percent of farm workers that made up the positive tests approached 6%. We are back down under 5% that had been the average, and right now it's actually at 3.7. 3.7 of all the cases in Ventura County are among farm workers. So I think we're doing very well there, working with and protecting our essential workers in the farm work industry. Finally, in terms of another important essential sector, the service industry, specifically grocery and food service industry that includes packing houses, just 2.3 of all the cases are among this sector. So while we have, again, over 12,000 Ventura County residents that have been tested positive for COVID, overall, on these vulnerable and essential sectors, I believe we're doing very well as a county, and things are working well with our contact investigation, our contact tracing, everyone getting tested, turnaround times on a timely manner, and so all is trending well. So with that, I'll conclude my remarks for today. Thank you for tuning in, and now it's my pleasure to introduce our next speaker for today's press conference, which is Dr. Tom Duncan. He is the VCMC's Trauma Center Medical Director. Thank you.
Thank you and good afternoon. Like Rigo said, my name is Thomas Duncan from Ventura County Medical Center. Can I have my slides up, please? All right. Well, today I'm going to be talking about our National Falls Prevention Awareness Week. And the reason why it's important is because we have lots of elderly individuals falling in our county and in the nation. We have a coalition that has been developed in regards to falls. So falls are a third leading cause of death in our nation, according to the CDC data, ahead of heart disease and cancer. And the National Cancer of Aging states that falls are the #1 cause of injury-related deaths, as well as unintentional injuries and hospital admissions in the elderly, leading to about 31 million admissions in the emergency department every year in the United States. So the question is, do we have a problem? Well, sure we do, because every hour on the hour, we have about 5 elderly individuals that die due to a fall-related reason. On the other hand, we have about every 11 seconds, an elderly person is taken care of in an emergency department due to a fall-related reason. And most of these falls occur in homes. About 70% of them occur in homes. Now, if you take a group of 65-year-old individuals, 1 in 4 of those individuals will fall every year. Now, you move that up to 80-year-olds. 1 in 2 of 80-year-olds will fall each year. And the amount of money spent is astronomical. For example, back in 2015, $50 billion was spent on fall-related reasons. Now, moving that up to this year, up to $68 billion has been spent to date. Now, the CDC also states that the number of deaths per hour will increase from 5 to 7 every hour in the year 2030. So as you can see, the numbers are going up, and it's increasing by 30%. Now, in regards to the reason for falls, we have home-related reasons, and we also have medication-related reasons. For example, at home, alcohol and drugs can be a reason for individuals to fall. Improper extension cords. For example, we have extension cords on the floor over here. They're taped down nicely, but at home they may not be taped, and individuals may tend to trip and fall over them. Wrinkled rugs can cause people to trip and fall. Falling out of bed, wet floors, as well as small pets with leashes on them can wrap around ankles and cause people to fall. And then improper footwear. Flip-flops, for example, cause injuries that we can prevent. Also, in terms of aging, comes along changes in our eyesight. Glaucoma and macular degeneration can cause people to fall because they have poor vision. Night lights are also great because they cause us to have adequate vision in the hallway when we wake up in the middle of the night to go to the bathroom. Polypharmacy or taking multiple medications can also be an issue. And then having poor strength or minimal balance can cause people to fall and have bad outcomes. And then dementia and vascular disease. Now, we found that several organizations in Ventura County were working towards the same goal of fall prevention, but working in silos. As a result of this, we formed a coalition between the emergency medical services, community-based hospitals, as well as trauma centers, and then public and private agencies. This is a screenshot of multiple logos of those involved in the coalition. As you can see, we have the board of supervisors right smack in the middle, and we really appreciate all their efforts in terms of supporting us through this. In terms of the role of our program for fall prevention, it starts off with the emergency medical services or the paramedics conducting fall prevention in the field. So when they go out into the field to take care of a patient who is fallen, they tend to evaluate the home, determine if there's a reason for why the individual fell, and ultimately make some recommendations and provide some literature to the individual at home. Now, of course, if they have to go to the hospital, they take them right away and don't have any delays as far as that goes. But when they get to the hospital, they end up having some other testing done to determine how safe they are or what kind of needs they have in terms of being able to get up and move about. The Fall Prevention Coordinator at the Ventura County Area Agency on Aging acts to follow up on these patients and determine which type of services they need. For example, some of them may need a public health nurse, and we're partnering with the public health department as Rigo Vargas is a director, and we really appreciate that because they can go out and determine exactly what the patient needs. Also, they may need home modification, so an agency can be sent out to evaluate the home, and other resources that are available in the Area Agency on Aging. Some evidence-based classes which are also offered can keep our elders up and about, and they keep them safe with giving them extra strength to be able to be balanced. For example, there are 4 of them: Matter of Balance, Tai Chi, Walk with Ease, and Stepping On. And all these have been evidence-based such that they've been tried and true, and they're known to work. So how can you stay safe during this pandemic? Well, there are a few things. First of all, wear a mask. Practice social distancing. And you want to get up and move around and sit less. Even gardening can help because you're moving around or walking in a home, although that can get quite boring, so walking outside in a socially distant manner is great. Video-based, evidence-based exercises or outdoor evidence-based activities are also good, and that way, like I mentioned, can increase your strength and your balance. We have a virtual fall prevention forum coming up because we can't have it in person. We normally have 2 events each year. The April event got canceled, but we're trying out this virtual event this Friday at 12 noon. It's going to be on the Area Agency on Agency's website in regards to their Facebook page. And we're going to have presentations. We'll have demonstrations, Tai Chi, Zumba, and nutritional demonstrations also. So it's going to be a great event, and I hope a lot of people can tune in to gain in access to this and learn from it. Now, one thing that we normally do at our presentations or our forums is we give vaccinations for flu, Shingrix, as well as pneumonia, but obviously we cannot do that this time around. So we're imploring our elderly to seek help from their primary care providers such that they can have their immunizations given, because it's really important. And I got mine yesterday, and I'm really proud of that. So here's our contact information, and we really appreciate the opportunity to talk about our program. Thank you very much, and have a good day.
Thank you, Dr. Duncan. That's a very good advice, especially for someone in my age group. First, I'd like to start off with a huge thank you to all of our teachers and our support staff and our administrators who are doing the essential educational work during this pandemic. But an even bigger thank you to the teachers, to the parents, and the students that have been pivoting and embracing a new form of delivering learning. As you may know, all of our school districts have elected to begin the school year doing distance learning. And we've made great strides since last fall when we had to make this pivot as a result of the shutdowns. Thousands of devices and hotspots have been distributed. More are continuing to be distributed. And instruction, even though we use fancy words like synchronous and asynchronous, our instruction is being delivered both real-time and anytime. But it falls far short of what we'd rather be doing. There is no substitute for in-person instruction of our students, particularly those in the lower grades that are just learning the key to all learning, which is reading. We want our campuses to reopen, but just like in the wildfires and the subsequent air quality issues, we don't want to do it unless it is safe. And that is a concept we've embraced and feel is ever more important during this pandemic. All of our districts do have plans to begin in-person instruction once the county gets into the red tier and can stay there for 14 days. Now, it sounds kind of funny to me because other than being inside the 20-yard line in football, this is the only other circumstance where going into a red zone is a positive. There's a number of components, which won't surprise you, that all of our schools are poised to implement. Most will be using a hybrid model of education, which is a mix of in-person and distance learning because of capacity issues and how many kids we have in our schools. Masks will be required for every single student in third grade and above. Our facilities and our equipment will be frequently sanitized. And parents, of course, will be instructed to keep their kids at home if they show any symptoms. We'll also be checking those same students, as well as our staff, for any symptoms on a daily basis. And students will be kept as much as possible in small common cohorts during the school day. This way, if we do unfortunately experience some sort of outbreak or a case, then we may not have to shut down the school. We may be able to shut down a classroom or a wing of that school and keep operating. And if there are positive cases, our schools are going to work with Ventura County Public Health on contact tracing. You also may have heard that some of our schools have been granted waivers. They're almost all exclusively in the private sector. Some of our public schools, as I speak, and their boards of education are exploring applying for waivers. Want to do so carefully because our operations at scale are much larger and we can't be as nimble as, say, a private school can be. but also in using a cohort model to implement small group instruction for groups of 16 or less, which would include the adults in the room, for particular groups of students, like special needs. The dilemma that we experience is our most vulnerable students, students of poverty, English learners, students with special needs and disabilities, are at most risk of losing more ground, of learning loss, and widening the achievement gap. But on the other side of the coin, the last thing we want to do is to place students in those groups in greater danger. So this has been kind of a push and a pull for us in education in deciding how to go. But as the future unfolds, red tier or no, a great many of our school districts, including our County Office of Education, will be exploring those cohort models so that we can address the needs of select groups of students in very small environments. Also wanted to reference, if you could pull the slide up, is our framework for reopening that was developed by our office in conjunction with Ventura County Public Health. And by the way, we are so grateful and value public health in the relationship that we'd enjoyed for many years in terms of, and I don't see the slide up, that's probably because I didn't press the button. There we go. But under the leadership of Rigoberto Vargas and Dr. Robert Levin, we continue to strengthen our ties and get great advice and work together toward a successful reopening of schools at the right time with safety as our top priority. This particular framework that you have on the screen is the umbrella under which each and every school or school district, public or private, can use for the development of their own plans. And we call it an umbrella and a framework because each school and each school district is going to be a little bit different, and they're going to have plans which are situational according to their needs. With that, I will thank you, and I will ask you to be safe, and I will ask you to act safe. And it is now my pleasure to introduce Mr. Mike Powers, the County of Ventura's Chief Executive Officer. Thank you.
Well, good afternoon. Thank you so much, Dan. It's great to hear the work that's going on with the schools and the wonderful partnership you do have with public health. And I can tell you they do talk regularly about how to move forward safely during the pandemic. And so much of what we're talking about today is health, and it was wonderful to hear from Dr. Duncan about fall prevention. And you might think, well, what is a trauma surgeon? Why is he out front talking about prevention? Well, because he sees at the back end what happens, and so he says, how can we prevent this from ever happening? And we know when someone maybe has a broken bone or a broken hip, that leads to other medical complications. So this fall prevention effort, the team they have and the community partners they have are making a big difference in improving the health of so many in our community. So we thank him for their leadership and support. Other health resources, wellnesseveryday.org. Really want to highlight that for you. There are resources that are available, and it's so important, especially at a time when we're asking our seniors to stay home. There's resources for them there, but also as we're talking about schools and teachers and parents and the stress of online learning for our teachers and our parents who are at home, and they have some good guidance on this site about how to help cope with some of those stresses. And it is so important to recognize and appreciate our teachers who've had to just instantly try to adapt to this remote learning environment, and they're doing so well. And it's not only is it change, but it's more time and effort and energy because they care so much about each individual student. So we just thank you so much to our teachers and to our parents for being so thoughtful in the way you've adapted to provide education to our community during this challenging time. Also want to talk about, just real quick, our business efforts. The Business Ambassador Program continues to reach out to our local businesses in a really consultative, positive way, and they've now visited over 11,000 businesses. There's over almost 15,000 who've registered, and so working really well, and more state numbers are available now. The state team has visited now over 3,880 businesses, and still only 3 violations. So it just speaks to the wonderful effort of our businesses who are doing it right, and that's helping with our rates, with our numbers. And I think you saw yesterday we've been engaged with the state leadership to let them know that we really think Ventura County is doing it right. Our numbers are showing that, our good positivity rate, our high testing volume, which has gone up even some, and our very low hospitalization rate. So, and the state acknowledged that we are heading in the right direction. And you heard Mr. Vargas say that we could be there very soon. But I would highlight also that once we get there, once we qualify for the red tier, we still have to pause for 2 weeks. We have to hold there for 2 weeks and meet those numbers, which we would rather not do, but that's the rules and that's the way they've set them. But we also think we can use that time for businesses to get ready, for schools to get ready, because it does allow some limited indoor capacity for schools and businesses, and religious services and gyms and so forth. So it's a good time to use that time to prepare. And thank you for all that you're doing, because those numbers are coming down, and that's going to help us reopen here safely very soon here in our county. Last thing I would just say is, again, prevention is so important. Get your flu shot. You can get them through your primary care provider. Also, public health has about 49 different scheduled events throughout the county, so please do get it. It's always important, but it's never more important than this year, when we're trying to avoid the twindemic, as they call it. And then in terms of a vaccine, we're all watching anxiously to see when one will be ready. But I want you to know as well here that we're preparing locally for when there is one. Most of the distribution, of course, will be done through state and federal resources, but we always know there's a local component in terms of storage, transportation, logistics, even things like refrigeration, because many of the vaccines require extreme refrigeration. Working with our local hospital partners to make sure they have the capacity, that we have the public health capacity to store and distribute these vaccines when they are ready. So we just wanted you to know we are working, because sometimes, like with testing, you can have all these great resources and it comes down to not having some little swab. Well, we want to make sure we have all the syringes and everything that we need. So we are preparing for that, and we'll be ready when the vaccine is ready. So with that, I just say thank you, Ventura County, for all you've done. We're heading in a great direction. You heard the state validate that yesterday, and I look forward to those continuing efforts. And stay connected at VenturaCountyRecovers.org. Now it's my pleasure to turn it over to Paul Stamper, Deputy CEO from our office, to talk more about our efforts to support businesses here in our county. Thank you.
Thank you, Mike. So as you heard earlier from Rigo, nail salons are able to open indoors here in our county now. And this is just one of many changes that have happened recently. And there's lots of reasons why we're going to be making changes as we go forward on a regular basis. Many times we're looking at state requirements. Sometimes there's some handful of local requirements. And then additionally, there's clarifications, which category does my business belong in? Is this part of my business allowed? And there's ongoing communication between our county and the state on this, and that's very often informed by our businesses. We have our trade organizations and local business owners that are staying in touch with us, asking good questions and giving us information to help us on that path. So I want to make sure that our business owners understand the best places for them to stay updated as we go forward. So this includes our VC reopens, VC recovers, and by making sure your business is registered with us. So I want to talk about each of those just a little bit real quickly. So again, at www.vcrecovers.org, this is the place where you'll find all of our local orders that have been published here. In addition, you'll find the frequently asked questions, and one of the things that's been added in the last several weeks is we put a date and we changed the color to red so you can easily pick out the things that have changed since the last time you've been to that website. So that's a great place to get updates. Then if you go to www.vcreopens.com, this place has been updated significantly since the blueprint for Safer Economy was released. So if you haven't been there since then, I encourage you to do so. Once you get there, you will find that this is going to always be updated with the current status. What tier are we in? And within that tier, what's open as it relates to the different business sectors. It will always have the guidance and the templates associated with those sectors, and then also any special guidance that locally is associated with that sector as well. So that's the best place for you to go and make sure you stay on top of your business or business sector. There are also the color codes associated with these tiers, and we are at the purple stage now, tier 1, but as soon as we do progress into tier 2, red, then that website will be updated in an ongoing manner to show the changes associated with that. So for example, when we move to the next stage, as Mr. Powers mentioned, there will be most or many of the local businesses that currently have to be outdoors will be able to move indoors to some capacity. For example, places of worship, restaurants, movie theaters can all go to 25% indoor capacity. Gyms can go to 10% indoor capacity. And again, this is the place where you would register your business. And I encourage you to look ahead to the other tiers. And just a reminder that our county needs to meet that case rate requirement for 2 weeks in a row before we'll be able to move to that next tier. I want to share some of the specific changes that have come out in the last week or so with our frequently asked questions. Medical massage is an example where we've identified that if you have a referral by a doctor or chiropractor for a massage for therapy, that counts as essential health care. That can be conducted indoors, while non-medical or spa-type massages are still outdoors at this time. Eyelash extensions fall under the category of personal care services, so those are outdoors at this time. However, tanning salons, they actually fall under the category of limited services. That's a category of services where you can perform those generally while maintaining your social distancing. And so that is allowed to be indoors at this time. And if you're unsure about if your business belongs into one of those types of categories, personal services, limited services, again, I encourage you to go to vcreopens.com. Restaurants here locally, if you're a restaurant, bar, winery, and you serve food and alcohol, the time that you can stay open has been changed to 11 p.m. from 10. So we encourage you to take advantage of that if it makes sense for your business. And live music is now allowed at those establishments. So solo and duet from the same household can play music at those locations for the people that are there eating. And they do need to maintain their distance and follow the guidance that's posted on our website. Golf carts. If you are a golf course and you implement the partition in between the driver and the passenger seat in the golf cart, then you can have 2 people in that golf cart from different households. RV parks were recently changed so that they can go to full capacity now. And finally, door-to-door activities. I want to clarify that at this point, campaign and political workers, they may go door-to-door now. Okay, so they can collect signatures for voter initiatives or campaign for elected offices. Census workers can also go door-to-door. Now, all of these groups will need to wear masks and follow the distancing guidelines that are published. Other solicitations door-to-door, they can hang flyers and leave things, but they're not allowed to knock or ring or try and engage the residents in any way. So you can see there's a lot of updates happening on a regular basis. We encourage you to stay informed about those. I also want to point out a webinar that's coming up for commercial landlords and tenants tomorrow. This is from noon to 1:30. You can register for this at www.edcollaborative.com. And they will have a panel of attorneys. They'll be talking about negotiation and dispute resolution. And so we encourage you to take advantage of that as well. And now it's my privilege to introduce our next speaker we have, who is Ron Ventura, supervisor from our Environmental Health Department.
Good afternoon. My name is Ron Ventura. I am the supervisor with the Ventura County Environmental Health Division's Vector Control Program. And I want to talk a little bit about the invasive Aedes mosquito that was recently discovered in Ventura County. On September 9th, we discovered a specimen in a trap we had in the city of Simi Valley. This mosquito specimen was taken and shown to California Department of Public Health, where they confirmed our finding as an Aedes aegypti mosquito. From there, we talked to Dr. Robert Levin with County Public Health and sent out a press release indicating that this was the first invasive Aedes mosquito found in Ventura County. This mosquito has some medical significance to it in that it can transmit some tropical diseases such as dengue, Zika, chikungunya, and yellow fever. It is important to note that these diseases are not readily transmitted locally anywhere in California at this time. So when we found this, we identified the neighborhood in Simi Valley, and environmental health vector staff canvassed the neighborhood where the initial complaint was received, and we sent out literature for these mosquitoes. The literature indicated that we have identified this mosquito and that we are encouraging the public to contact us if they are experiencing bites. Another important aspect of our literature we submitted was education on how to eliminate this mosquito from their yard. This mosquito is a small black mosquito with identifiable marks. They're white stripes on its back and white bands on its legs. It's smaller than the native mosquitoes we have here. It's typically an 1/8 inch to 1/4 inch in size, and it exhibits day biting habits, which most mosquitoes do not. Most mosquitoes exhibit dawn and dusk behavior, but this mosquito does day biting, and it bites aggressively. It has a certain affinity towards humans in the fact that they prefer the human as their host, whereas most native mosquitoes choose small animals and birds as their host. So it wants to live in and around your home. So right now we are encouraging the public, where we have found this mosquito and it has been infested in that area, to canvass their properties and search for stagnant water where these mosquitoes breed. These mosquitoes tend to lay their eggs in containers just above the water line. So once they have laid their eggs, these eggs can stay viable for up to a year without being wet. Once wetted, they can then hatch, and then within 5 to 7 days, under ideal conditions, and Simi Valley is hot as well as other parts of Ventura County, they can hatch, again, within 5 to 7 days. So they need to canvass their yards at least every 3 days to ensure that there's no stagnant water. These mosquitoes, again, they bite very readily, so you need to protect yourself. And the best protection there, if you are outdoors, is a long sleeve shirt, preferably loose, pants, socks, and shoes. If these mosquitoes tend to continue to bite, it is best advised to purchase an EPA-approved repellent, such as DEET, picaridin, ER3535, or oil of lemon eucalyptus. All these will prevent the mosquitoes from hopefully biting you. Because of the affinity they have towards humans, they tend to find themselves inside your home and also bite while you're sleeping around your ankles and back of the elbows. So please ensure your doors are closed. Ensure your screens are in good repair. There's no holes or tears in that screen. And do let us know if you are experiencing these invasive Aedes mosquito. If you think you are, we're encouraging you to call the Ventura County Environmental Health Division Vector Control Hotline, and we could be reached at 805-658-4310. There's also additional information on our website, which is vcrma.org/invasive Aedes mosquitoes. We are taking these complaints, we are plotting our chart and map, and we're trying to determine the infestation we currently have. And it is important, again, the public plays a very critical role in suppressing the spread of this infestation by canvassing their yards and making sure they do not have any of this standing water or stagnant water in containers, in plants such as bromeliads, etc. So thank you very much. And with that, I will introduce Supervisor Callie Long.
Hello, thank you very much. I hope that everyone found the information that we provided today as helpful as I did. Ventura County believes that our community needs to be updated with the information valuable to you as soon as we possibly can. So please follow us on our Facebook, Instagram, Twitter, Ventura.org. We have VenturaReopens.org. We have VCEmergencies.org. We are on radio, on the TV, in any place that we can to make sure our information is out there. Our Board of Supervisors' next meeting is October 6th, which will have a full update on the COVID-19. And if there's any more information, we will get that out as quickly as possible. Until then, we'll see you at the next press conference next Wednesday at 1 o'clock. Thank you so much. Be safe and healthy out there. Thank you.